to Sally's Medical Clinic. My name is Alyssa. What are you here for today? You're here for an eye exam and the glasses. You want to try out some glasses and a fitting. Okay, sounds great. Can I have your name, please? Okay, and your last name? Okay. And what time was your appointment for? For what time? Okay, so let me just look here. Okay, yeah, okay. So Dr. Alyssa, she'll be helping you today with your appointment, with your checkup. So if you'd like to just please have a seat, and she will call you in just a minute when she's ready, okay? Okay. Yeah. Yeah, they're right over there. And here's their file. Yeah, just for an eye exam and checkup. Okay, here you go, thanks. Hi, hello. My name is Alyssa. I'm gonna be the doctor helping you today for your eye exam. I'm just gonna go ahead and put on a pair of latex gloves first, okay? Because I'm gonna just be touching around your eye, and I don't want to, transfer any dirt or, get any infection into your eye. So I have these two latex gloves right here. I'm gonna go ahead and put these ones on, okay? Okay, let me just take a quick look at your eye first, okay? Just want to check, see if your eye looks healthy. Make sure there's no redness or puffiness or any discharge coming out of your eye, okay? Okay, everything looks good. Okay, now just let me go ahead and touch around here your eyes. Do you feel any tenderness there? Okay. Check the other side, please. How about there? What does that feel like? Okay. Now, if you just close your eyes, I want to check your eyelids. Okay, and the other eye, please. Just keep it closed. Okay. And just touch around the eyes. Just feel around here. Okay. Just around here like this. Okay, looks good. Your eyes look pretty healthy, and well conditioned. The next thing that I want to do is get a cloth or like a little cotton pad, just to wipe around on the outside of your eyes to remove any oils or makeup that you may have. I'm going to go ahead and put a little bit of solution into your eyes, kind of like to dilate them before we test them any further, okay? So, there it is, okay. I'm going to grab it from this box. Okay, so here we have the cotton pad. So I'm just gonna wipe your eye. Yeah, keep them closed. Okay, very good, good. And the other side over here. Okay. There we go. How does that feel? Are you feeling okay? Alright, you just let me know if you feel any discomfort at any time, okay? Okay, so... Oh, sorry, are you okay? Okay. Yeah. Don't worry. I'll be as gentle as possible. So the next thing I'm gonna do is, I have a Q-tip here. I'm gonna use the Q-tip to gently poke around the outside of your eye, just to have a little bit of oil and special type of serum that's gonna go towards the inside of your eye. It's gonna help dilate it for me without the use of drops, because I find that a lot of people have trouble keeping their eyes open when the drops go in. So this is a fairly new technique that's being tried out that so far had really good successes. So I'm confident that it will work very well with you as well. But if at any time you feel discomfort, irritability, or pain, please don't hesitate to let me know, okay? I wouldn't want to cause you any pains. Okay, so here we go. Just gonna dip it in a little bit more of the serum. Okay. So I need you to hold still as much as you possibly can, okay? Okay. Okay. Is that okay for you? Yeah? Okay. Okay. Just a little bit right there. Okay, is that feeling okay? Great. Okay, just like that. Now, just try to keep still for me, okay? Keep still. I know it's hard. It's hard. Just try your best, okay? Okay, just a little bit more over here. And there we go. Okay. It's very fast activating, so we can get started right away. Just gonna get the lights. I'm just gonna get you to follow the lights. If you are at all sensitive to lights, please let me know. And I will dim the light for you, or we can try something else, or we can skip past to the next step, okay? If that's something that you're feeling sensitive to, okay? The lights. I just need you to follow the light, okay? Okay. Follow this way. Okay. Follow this way. Okay. Follow up, 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 up. Down, 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 down. Okay, to one side, to the other side, to the center, in circles. Okay, very good. Okay, you're doing a really good job. Just keep your eyes open, open, open. Okay. Just a little bit more. Okay, there we go. Very good. I'm going to go ahead and get the other light now. Okay, so go ahead and follow the light, okay? You might see a little bit of green coloring, but I want you to just focus on the white light right here, okay? Okay, keep following, following, following. Follow the light. Very good, okay. I want you to just look at my nose, okay? Look at my nose. Okay, very good. So your eyes have nicely dilated and ready. Perfect. So I just see a little bit of liquid coming out. A little bit of discharge. Kind of like tears. Which is normal. Just gonna go ahead and grab a tissue just to wipe it away. Okay. Let's go ahead and close your eyes. Perfect, okay. Now, can you tell me how many fingers am I holding up? Okay, now? Now? Very good, well done. Now? Okay, now? Now? Okay, now? Okay, now? Now? How about now? Okay, very, very good. Just take a look here at your eyes. Next, what I'm going to do is I'm just going to test the prescription. I'll get the prescription here for your eyes, okay? So, how's that? Okay, and that? And that? And that? Okay. Let's try Try a little bit more. How's that for you? Okay. And that? Uh-huh. And this? I'll go back a bit. How about here? Uh-huh. Okay. How clear can you see me? Okay. And now? Okay. Okay. And how well do you see? Okay. And now? 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 Okay. Now? Now? And now? Okay. And now? And now? And now? And now? Okay. Just gonna adjust it a little bit more. Okay, so I think that's good. Let me just go ahead and, here we go. Jot down the results on that, okay? So, so we have that, and the other number there is, okay, this one was, okay, that, okay, very good. So we got your prescription for you. Next, I will show you a few glasses. You can decide which pair you like, and then we can go ahead and fill the prescription for you in the lenses that you prefer, okay? Just gonna go ahead and take off my gloves first. Okay, so we're done with the gloves. Now, I'm going to show you 3 pairs of glasses. 3 lenses. You've already given the receptionist some of the criteria that you're looking for with your glasses, so now I'm just going to show them to you, a few that we have. Hopefully you will find something that you like, okay? So we're gonna look here in this one first, in this case. And the first pair that we're gonna find are a pink type of glasses. They look like this. Okay. And these glasses have a oval, large cat type oval part for the eyes. They also have little shiny hearts at the top. Can see them there. And these do come in transitionals if you would like transitionals. So that way when you're outside they will automatically turn dark like sunglasses. So I'm just gonna go ahead and show them to you. You can take a look at them and try them on. And of course they can be adjusted here, the curves at the back for you, just the way that you like them, the way that fit you well, okay? Okay, so here you go. You go ahead and try those on. Okay, Good. Let's see. Okay, they look very nice. They make your eyes look bigger and stand out quite nicely. I think those are very, very nice. What do you think of them? Mm-hmm. Do you like them? Like them? Like them? You do? Mm-hmm. Okay. They just need to be what? To tighten a little bit? Okay. That's absolutely something we can do. I just take them off, okay? So you like this pair? Okay. Yes, it does also come in a green shade as well. We can take a look for those in the back if you like. And you like the idea of the transitionals? Yeah. Okay. No problem. So I'll just go ahead and put these away so you can take a look at them again after we see the others. Okay, so I'll pop that back in the case. And we'll go ahead to our next pair, which are in this one. Okay, and these ones are also a kind of pink color, fuchsia style color, but they're actually more kind of purplish on the inside and more pink on the outside. Sorry, that's vice versa. It's pink on the inside and more purple on the outside. And they have a lovely flower here on the side with a little gemstone. You can see the sort of purplish color there. And these ones are more square shaped. They're a little bit thicker here on the sides than the other pair. These ones are not currently available for transitionals, however. These ones are just standard lenses, but I do think you have a bit of a stigma on your right eye, and these ones we can accommodate that with these lenses. Yeah. So I'm just gonna go ahead and show them to you, and you can take a look, try them on. Glasses, glasses, glasses. Purple, 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 pink, pink, pink. Purple, pink, purple, pink. Glasses. Glasses, glasses, glasses. Purple, 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 pink, pink, pink. Purple, pink, purple, pink. Glasses. And as you can see here, these ones, as well as the other ones, don't have any of those little parts here on the side. Those little ball type things. Because you had mentioned that that's something you don't really like, right? Me as well, I don't really tend to like that type of style. How's that for you? Those ones also suit your face quite well. Quite well. I think they look really nice. And they actually, yeah, they do bring out the greenness in your eyes. Yeah. A little bit here tighter at the back. You think you'll need it? Okay. Sure. Yeah, no problem. Okay. So you're happy with this one as well? Okay. Even though it's not a transitional, that's okay for you? Okay. Well, great. So I'll go ahead and put these aside. I'm going to have one more pair to show you. These are a bit more of a masculine pair. They're not as funky and out there as these two pairs are. And that's going to be in this container here. Okay. They're going to look like this. This is a little bit more of a simple, casual type look. And these ones do have the little balls here in the center. So I'll just go ahead and show you these ones, and then you can try them on. Gray, black. Gray, black, white. Gray, black. Glasses. Gray, black. Gray, black, white. Gray, black. Glasses. Okay, go ahead and give those a try. Okay? There you go. Do you like those? Those? They're not bad. Like I said, they're very simple looking. They don't really pop or have a lot of personality. They're quite simple and basic, but sometimes that's all you want to go for, right? Sometimes that simple sort of casual look is all that you really want to do that day. So, it's totally up to you. You quite like it. Okay, that's lovely. So you're thinking, okay. Oh, you're thinking about all three of them? Okay. They are quite expensive. Yeah, these ones do come in transitionals. Okay. Well, okay, here's what we'll do. How about I take these 3 pairs up to the front. We go ahead and you just take a bit of a rest. just go throughout the rest of the mall. We're going to fill out your prescription and fill out your file, update your file, and things like that. You go ahead and take a lunch or something, come back, and then you can just revisit these 3 pairs of glasses and see which ones that you like. Then we'll go ahead and set them up for you. You'll be able to come get your glasses in the next couple hours. Sound good? Okay. Yeah, sometimes you just need, like, when you see a lot of new things at once, you're like, I want. But then later when you see them again, you're kind of like, not this one or not that one. So that might happen. That might work out in this case for you as well. Because like you said, yeah, you just have the funds for 2, right? 2 pairs? Yeah. It's really hard to choose, I know. Okay. So I'm going to go ahead and put those away. I'm going to take all your glasses up to the front. I'm going to let the receptionist know what's going on, the situation, everything. Yeah, and then I'll see you back here in a few minutes or so, 10-15 minutes, or half an hour if you would like. Okay. Yeah, just ask for Dr. Alyssa, and I'll come out to have a chat with you, okay? Okay, it was really nice to meet you. Thank you so much for coming today. You take care now. Bye-bye.